Hello and welcome to the Caring View, the online health and social care platform free to access to everybody. Usually live, but tonight is a pre-recording. I'm getting that in first so you don't think we're ignoring you in the comments. We are not. Please do continue to sound off in the comments though, because Mark and I will read them after the show has gone out. And any questions that are posed in there that don't get answered, we will try our hardest to answer for you. Before we get started, don't forget to hit that like, to hit that subscribe, follow us on all of our regular platforms. So we're going live on LinkedIn, X, Facebook, Instagram, you name it, we're there, and obviously YouTube. Go to www.thecaringview.co.uk to access all of our free resources, to catch up on all of our past episodes and our podcast episodes, and to find out about our wonderful sponsors and all of our fabulous suppliers. Everything we do at the Caring View everything we do at the Caring View is completely free to access. We don't charge you for anything, and we're only able to do that through the fabulous donations and wonderful generosity of our sponsors. So quick roll call before we get into tonight's episode. So please do check out Prosperwell, the UK's leading digital marketing agency. Their address is there. All of the website addresses for all of our sponsors will come across the screen throughout tonight's show. We have CBAT, Care Business Associate Training. So for all of your health and social care needs, go and check them out, especially if you're looking into chaps. I'm a huge advocate for chaps, so go check out CBAT for chaps. We have Attis Care by Attis Insurance Brokers, the comprehensive care coverage, proactive risk management. Oh, everyone hates insurance, but we all need it, so go check out Attis. We also have Log My Care, the intuitive care management platform loved by complex care providers all around the country. Do go check them out. I remember when they started off and they gave out their program for free. Do you remember when it was like really small? And it was like trial our care plan and stuff years ago, even before I went DSCR. Fantastic stuff. And finally, last but not least, Florence, directly connecting health and social care professionals and organizations with shifts and training. Do go check them out, especially Florence Academy. Oh, I think that is everything I need to do before we get started. Like I say, we are not live. This is a pre-record. Do go into the comments though, ask us questions, put stuff in there. If you've gone through an inspection and you want to give your experience, please do go into there as well. And also let Mark and I know if you want to be part of a show around living a real inspection. We would love to know. You can contact us directly through our website under Work For Us. I think it's on one of the side panels. Oh, good evening, Mark. How are you?
Yes, not too bad, thank you. You?
I'm very good, Mark. I'm very good. I put up my autumn decorations and I'm dead excited. However, every year I buy more and more autumn decks and buy more and more Christmas decks. That is to be said. And every year when I get them out, I always think, thought I had more.
Yeah, I buy Christmas decorations every year. And every year I think, it doesn't seem as much.
No, I want to go buy more now. And I know I shouldn't because I've got an attic that has more boarding that's required just to store all of my themed decorations. I think at last count, I've got about 45 pumpkins in the house. But because we've decorated and we've done more and we've moved into different parts of the house, I'm decorating all the rooms as well. Apart from Stephen's office, it's his safe space. But I'm decorating all the other rooms as well. So I think that's maybe why I feel like I've got less.
Yeah, you're in a bigger house, aren't you?
Yeah. So I've spread it out now, spread it out more. So, no, and I'm very excited. I'm back into my candle making as well. For those listening, and this is going out, I think, tomorrow. So this is Monday, tomorrow's Tuesday. So today's Tuesday when you're listening to this. I did go through a CQC inspection recently, and I sort of lost my way in what de-stresses me, what calms me down, what relaxes me, what's my safe space. My safe space is crafting. So I've gotten back into my candle making. So I made some candles this weekend infused with crystals. They're very nice.
Very nice, very nice.
That was my long way of saying yes, I'm okay.
I was listening to you talk about Log My Care and the freemium version. They still offer a free version. I'm just on their website. So if you're a new provider, up to 10 service users you can have on their free version.
Oh, fabulous. Oh, so new budding services, go check them out. This might be your first foray into digital social care platforming. We will make sure, like now, all of their addresses are coming up on the bottom of the screen. Mark, we're almost care show season as well.
We are indeed. 9th and 10th of October. Less than a month. It's absolutely crazy how quickly it's come around. But yeah, really looking forward to it.
Are we doing a social gathering in the evening?
We are indeed. I will share the links in a bit. We've done a QR code. There's a post out on our social media, so you can join into the WhatsApp Just waiting to double check numbers, and then we can book a restaurant and bits and pieces. But that link is out there on the social media, so do check that out.
How exciting! Oh, I can't wait. I say it's been ages. It's been a year. It's been a year since the last Care Show Birmingham, and it feels like, well, way too long. I didn't do Care Show London this year, so I feel like I've missed out. Apart from, I think I did a day at UK Care Week. I've missed these events, so I'm looking forward to it this year.
I always think Care Show London doesn't have quite the same vibe in terms of everybody staying over for the second day.
Yeah.
And I don't know, I think Birmingham was when so many people met during COVID and came together. I think it holds like a semi-special place, put my teeth back in some of our hearts.
Yeah, well, I honestly, I will remember that one until my dying day. An absolutely fab Care Show, that just on the back end of COVID. So tonight, I would say, is rounding off our series of the CQC inspection framework, but it's not. It's not. We are going to do more, and we are going to do a special episode all around what it's like to go through the single inspection framework, because yours truly sits here every week going, oh, it'll be fine. 6-hour inspection, none of this arduous 3-day malarkey. Oh, it'll be super simple. Just follow our tips and guidance. Still follow our tips and guidance. We've given you loads of good tidbits to get yourself started. However, it's a fallacy. It is not a 6-hour inspection. It is incredibly long and incredibly hard. And I do want to be able to give you all my direct insight into what I found during the new single inspection framework, and how you can better prepare yourselves moving forwards, especially if it's going to be your first inspection for a while, because they will use the B word, benchmarking, and they'll want to inspect you under all 107, and he told me this 15 times, 107 evidence categories alongside the quality statements. We are trying to work on a document that pulls those evidence categories for you, and gives you tips and hints as to what to have ready for those evidence categories. We aren't there yet, but we will have that done as soon as we possibly can do. I think the other thing to note as well is the Penny Dash report, which we were all expecting around August time, which was then around September time, has now been pushed back again from my sources, and we will be looking at getting that at some point in October. When we do get the Penny Dash report, we will do an episode where we discuss and go through it. I can't imagine there's going to be much in the full report that's not in the abridged version that was released earlier on this year. But for anyone sat waiting with bated breath for the Penny Dash report, wait a little longer. It will come trick or treat season. But tonight we are discussing the well-led domain. Mark, over to you.
Thank you very much. So yes, we are discussing well-led. So we've got a number of the quality statements that sit under well-led. But the first one is shared direction and culture. So CQC say we have a shared vision, strategy and culture. This is based on transparency, equity, equality and human rights. Diversity and inclusion, engagement and understanding challenges and the needs of people and our community in order to meet these. So I actually really like this quality statement, because I think for the last, ever since I've joined social care, so way back when I was like 17, and I'm sure everybody else is the same, we've seen people that kind of set up, they don't set up a company for the right reason. I think they come into it thinking they're going to make a quick buck, and then they leave and they go further down the road and they set up again. But they kind of leave a lot of staff kind of picking up the pieces with the people that they've supported, a lot of people that probably leave the sector because of kind of their bad experiences working in social care. And I think we also have obviously the teams where they're understaffed, under-resourced, undertrained. And I think this quality statement just kind of sets out actually what CQC are expecting from care providers. But I think also they've said through this, and we can dive a bit deeper in a minute, actually they're going to monitor actually people that do hop down the road and start again, and then inspecting and they close and restart. So Adam, what are your thoughts around the shared direction and culture one?
I think for me it's something that's integral to make sure that your service is going to be able to run the way that you want them to run. It's important that we have our team, we have our residents, our service users, our clients, our customers, whoever we want to call it, on board with what we want to do. But I suppose it's also really important that our stakeholders buy into it as well, and that our stakeholders know who we are, what we stand for, and what we do. there are a lot of things in shared vision or shared direction and culture that are quick, easy wins, and there's a lot that you're going to be able to evidence effectively. I suppose my thing on this is don't try and evidence something that isn't there. So if you know full well that your vision and values are not embedded through your service, be honest about that, but have an action plan ready of how you're going to improve that moving forwards. I think one good litmus test for myself that I've done in the past and still do quite regularly is when I'm walking around a service, I will always, stop and chat to the team. I'll stop and chat to people, and I will ask, do you know what our vision is, or do you know what our values are? And you can usually tell how well embedded and how well believed your value set is by how many people can give you the answer of what your values are. If you stop 10 people and only one person can tell you who your values are, there's some work to do there. And by work, I don't mean just shove loads of posters up around your home. I think it's really important to understand why that value and vision embedded piece isn't really evident at this moment in time. So have we included our teams in developing visions? Have you included our teams in developing values? We had a really good episode not long ago, didn't we, with Kavita Brown talking around visions and values and how we can get those embedded further. So please do go check that episode out. But it really is around making sure that you've involved people every step of the way, making sure that if you're going to be setting goals for your organization, that those goals are agreed with your team. And how are you evidencing that? So do you have team meeting minutes? Do you have directors meeting minutes? Do you have, if you're a group, meeting minutes for your group meetings? Are you minuting it in supervisions? Are values part of your supervisions? Can you evidence that? Can you evidence it through your job interviews? Are they in your job descriptions? Do you send them out as part of an employment pack or a recruitment pack? Do you send a bit of a who we are with them? So things like that, really easy to evidence. The hardest part is evidencing that it's been embedded within your service. I won't hog all the time on this, Mark, because I know we recently did an episode on this not long ago, but making sure that human rights is really understood by your team and that equality and diversity and inclusion is embedded throughout your service. So making sure that they understand FRIDA in relation to human rights, making sure that they understand the difference between equity and equality, making sure that everything that you want to achieve is for the betterment of everyone and no one's left isolated. I think those are hugely important. CQC are going to want to see copies of your policies. So they're going to want to see your equality, diversity and inclusion policy. They're going to want to see your safer recruitment stuff. So how are you ensuring that through recruitment, you're doing it the best way you possibly can and the safest way you possibly can? They're going to want to see policies around human rights and potentially around your Mental Capacity Act as well and how you're utilising that. And they're going to want to see training records. So make sure that you've got your matrix to hand, that you've done your human rights training. By human rights, that'll probably come under your EDI, DEI training, whatever you do, as well as your Mental Capacity Act training. So make sure you've got all of that to hand ready to show to them, but also make sure that it's believed through your team. This isn't a tick box area, really. This is something that is going to take work and it's going to take time. And if you don't have it already, it's going to take time to embed. So I would really invest some time, potentially a little bit of money, but mainly time, into working on this shared direction through your homes, making sure when you have your meetings with relatives and residents, you start off by saying, just to remind everyone what our current vision is, what our current goal is for this year. This is what we really want to achieve. This is who we are and what we stand for. And this is what our values are. And making sure that everyone who uses your service, lives in your service, works with your service, visits your service, totally gets who you are from the offset. Whether they're core values or the other types of values that we discussed in our previous episode, that's down to you. But it's around making sure that they're there, they're embedded, they're believed, and that you can evidence it as well.
No, absolutely. I don't think there's much focus on the CQC website under this around equality and diversity as there should be. There's not that much great further reading and best practice. All I would say is obviously Skills for Care workforce plan under the Attract and Retain does have the recommendation and commitment from CQC around the regulator support. So they have said that CQC have committed to assess quality in these areas at a system level. They'll check pay, terms, conditions, equality, diversity and inclusion under the leadership, including sharing good practice. So I reckon it's coming, but I'm surprised it's not there already, if I'm completely honest. But
no, I agree.
I was going to share some links to the Vision and Values show and the workforce plan, but I think it'll look too higgity-piggity on the screen. So I'll make sure that we share them onto our social channels, so keep an eye out for them. So the next one is capable, compassionate and inclusive leaders. So the CQC say that they expect providers to have inclusive leaders at all levels who understand the context in which we deliver care, treatment and support and embody the culture and values of their workforce and organisation. They have the skills, knowledge and experience and credibility to lead effectively, and they do so with integrity, openness and honesty. What are your thoughts on that one, Adam? Part of me thinks it's going to be quite hard for them to see. I mean, I know you'll have obviously the safer recruitment, which you've spoken about. They'll be looking for things like succession planning. And again, we've done a great show on succession planning, which we had Skills for Care join us on and some other people within the sector. But it's going to be hard, I think, for how they check whether your managers have those. I mean, obviously they'll speak to their staff, but a manager will be able to tell them exactly what they think. But actually underneath, do they really share the same values as an organisation? Because there will be managers out there that might not necessarily share, especially if you've come into it to care and you're working for a very profit-driven company. It's going to be hard, I think, to assess that personally. But
so, yeah, a lot of this is really going to come from feedback. So feedback from staff and leaders, feedback from people's experiences, potentially feedback from the external providers, people who work with our services. I think for me, what you really need to be able to have here is evidence that you're doing everything you can from shared direction and culture. So do you have a supervision matrix that you're logging your supervisions on with your teams? Can you evidence that you've worked on actions from those supervisions and you've supported your team to grow from that? When they're talking to your team, they're going to want to know, is this person approachable? Can they come and talk to you? Have you spoken about, and I know the next quality statement's all around freedom to speak up, but have you spoken to your team about the ways in which they can provide feedback and they can raise concerns to you? Do you do your team surveys? If so, what are your results from your team surveys? And have you acted on anything that you found from those surveys? It's one thing to do a survey, but if your surveys come back from your team and every single member of your team has said we want longer breaks and you've done nothing about it, not addressed it and not fed back, you're probably not going to meet what they want under capable, compassionate and inclusive leaders. How are you managing your supervisions? Are they all incredibly negative, or are you providing positive supervisions for people as well? One thing that we've recently introduced, which potentially might help others, is if you're using agency and you're using agency team members, making sure that, because I'm going to be very careful when I say this, because I don't think anyone comes into care to do a bad job. I think people come into care because that's what they really want to do. Maybe that's naive of me, but that's what I truly believe. Anyone who wants to come and work in social care will be doing it for the best reasons. But we do get agency workers that come and work, and our own team, but it's harder with our own team because they're employed. But with agencies, we can turn around and say, actually, I don't want this person back, or I don't feel safe with this person here. And we do that. It happens in all services. But are we logging that? Because logging that based on feedback from, say, your residents or from other team members or from relatives who might say, oh, that person that was here yesterday, that was the agency. They did this and it made me feel a bit uncomfortable. Okay, not a problem. We won't have them back. Log that on a matrix, and then you've got your evidence then to say, look, I know we've used agency. However, this is the feedback we've had around some agency workers, and this is the reason why we don't have them back in the service. So you're listening to that poor culture, that poor working ethics, and you're removing that from your service. So you're stopping it from damaging it. Are you listening to your team through suggestion boxes? Are they giving you sort of tips on what's driving morale down at the moment, or are they telling you what's working really, really well? And, you know, please don't lose this because it's really, really great. And we don't want to lose this. We absolutely love this. And are you acting on that as well? Are you making sure that your inductions cover quite a lot of this, well, pretty much hopefully everything that you need them to, including being visible through that person's induction as well? So, for example, on day one of the induction, does someone just show up at the door and hope someone's going to meet them? Or do you prepare it so that that person's first day, they are met at the door by their induction buddy or by yourself as a manager or your deputy manager or your clinical lead or a senior nurse? And are they made to feel warm and welcome from the very get-go? You know, it's around understanding that as a leader, as a captain of a ship, is this person who's in charge of the welfare of not just your residents and your team, that you're taking that seriously and you're acting on that as much as you possibly can do. Yes, we're going to have bad seeds. Yes, we're going to have people within our organization who will never be happy. But if you can evidence that if someone's been unhappy and you've done what you can do to try and turn that unhappiness around and they're still not happy, you've got the evidence that you're listening. You've got the evidence that you're supporting them. Make sure that you don't have favoritism. Make sure that if you do one thing for one person, you do the same for another, not in exactly the same way. We don't want to treat everyone the same, but we want to treat everyone equally. But making sure that actually you're working with your team, that every single team member is as important as they possibly can be. It is difficult to evidence this. I suppose if you're a director listening to this, how are you recruiting your registered managers? What sort of induction are your registered managers getting? What sort of supervisions are your registered managers getting? How are you sourcing those registered managers? How are you growing those registered managers? Again, what Mark said, succession planning. How are you evidencing that? And if you are a registered manager, how are you doing that with your deputies and your senior team? You know, how are you making sure that you're doing the best you can to make sure you're employing the right people? I think it's regulation, I'm going to say regulation 18, but I think I'm wrong. Fit and proper persons, it might be regulation 19. It's been a long day. How are you making sure that all of those people that you're taking on board are there for the right reasons and not just to fill a vacancy slot? And all of that, although sometimes difficult to evidence down on paper, will come out in volumes when they come and talk to your team, when they come and talk to yourself, when they talk to partners, when they talk to people. All of that will start to come through. I suppose one thing to bear in mind on this is around responsibility. It's around accountability and making sure that we don't want, you know, authoritarian hierarchical structures within our homes. You might do. I'm not going to tell you what to do, but around making sure who in your team is responsible for what and that they know they're responsible and that they're accountable. So if CQC come around and they go, well, this medication audit's not been completed, why is that? And you go, well, I don't know, not my job. As a registered manager, not good enough. But you also want to be able to go, well, actually, that was the role of the clinical lead. The clinical lead hasn't completed it, and I've picked this up already. And we've actually had a bit of a supervision to understand why they didn't complete it. So it's on my list to then follow through with. But obviously, it can't become a me job because I need to be able to do what I need to do. So I need to understand why the clinical lead's not been able to complete it, for example, just an example. So it's around the team themselves understanding what they're responsible for and what they're accountable for. The last thing anyone wants to hear, especially you as a registered manager, from anyone within your team is, it's not my role, it's not my responsibility, it's not my job. Everyone's got a responsibility and everyone's accountable, but it's around understanding as well who's accountable for what within that service and then making sure that that's embedded within your team, because that will speak volumes when your team speak to CQC, and when you speak to CQC, they'll be able to triangulate what's going on and they'll say, actually, yeah, what they said matches up and we can see the evidence for it here.
No, absolutely. Some great bits there. And I think just listening to you there, something that popped into my head was around actually, if you are a registered manager or even the director, how you challenge each other, you know, that professional challenge and actually how you come to a mutual decision of what you're going to take when there's a difference of opinions. Fit for person, you were close. Reg 19, I won't lie, I didn't know that off the top of my head.
I said 18 or 19.
Yeah, you were close. You were close. I'll give you half a mark. So the next quality statement is freedom to speak up. So it's a short quality statement, but CQC say, we foster a positive culture where people feel that they can speak up and that their voices will be heard. I'm pleased this is in here because I think we've had too many abuse cases such as Winterbourne View and all the others that we all know about and are all documented heavily. And actually this one aims to prevent those closed cultures, make sure that you've got whistleblowing procedures in place and that staff feel that they're able to raise concerns without any kind of fear of comeback from them. What are your thoughts, Adam?
Oh, no, totally. And I think a lot of it is what we've just spoken about, isn't it? Is around, sorry, I'm trying to. Oh, and I think you just lost me for a second, but I'm back. Don't worry. My internet dipped. Well, we've just spoken about this, haven't we, to an extent. So for me, what I would be saying here, evidence-wise, especially, is minutes from your team meetings, minutes from your supervisions, if you've got them, which you should have them. Staff surveys, team surveys, evidence from those, evidence that you've done something with them. Don't just rely on your team surveys. What other methods have you got for people to be able to feed back to you? So have you got on the spot surveys that people can complete either digitally or on paper? Have you got a suggestion box? And if you've got any of those, what are you doing with that information? Have you got a policy that covers it of how you're going to sort of get that back? Make sure you've got your whistleblowing or freedom to speak up policy to hand. Make sure that your team know it and that they understand it's there. And if you can, evidence that they've read it. Making sure that you can evidence that when you've had complaints from your team, you've done something about them. But I wouldn't say just your team on this. They're going to want to see your complaints and compliments policy in relation to this. And in that, you're going to want to be able to say, in your policy that there is no negative impact from anyone that wants to raise concerns, blah, 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 freedom to speak up and all of that, whistleblowing. But any evidence of complaints that you've got and how you've dealt with them, how you responded to them, when did you respond to them, when would they close down, and what lessons have you learned from them as well? Let's go all the way back to the first key question, which is safe, and the first quality statement under that, which is learning culture, sort of comes full circle here, because they're going to want to see, well, actually, you've shown me your lessons learned from it, but now I'm looking at how it was managed and how it was handled. So keeping them all together will really, really help you with this. I would also say have a look at your online reviews at this point as well, and how you're responding to your online reviews. Because if people are raising stuff online, they're usually raising stuff online because either they've raised it internally and you've done nothing about it, or they don't feel comfortable raising it internally. There are a small portion of people out there who is neither. They just want to go online because that's what they want to do. That's what they get their kicks off with. But how have you responded to those online as well? Because they will be looking at all of those avenues of feedback about your service when they build up a portfolio. And if someone puts a thing up online that says, they treated my mum terribly, the food was always cold, and your response is, well, you're lying. Is that really the way that we want to be able to do it? Is that really fostering that positive culture? So just look at that as well. So they're going to look at the tone of what you're saying, how you said it, when you've said it, how prompt you are in saying it, as well as all your processes. So your policies, your meetings, your minutes, feedback avenues, how's that communicated? Do people have access to that complaints policy? Is it in bedrooms? Is it an easy read version? Is it 4 or 5 pages long? And if so, is there a one pager that you can give to people which clearly says, if you need to make a complaint, you go to this person. If you've not heard back by this date, you go to this person. If you've not heard back by this date, you go to this person. These are your options. This is your CQC. This is your local authority. This is the ombudsman. Is there a one pager that you can give out to people which covers all of that, so they don't have to flick through the policy as well? Those are all of the sort of things that I'd be looking at, Mark.
Yeah, no, definitely. I love that one pager idea. I think it should be laminated on the wall for people, an easy read version. And like you said, actually, then people know what the expectation is. They know how long it's going to take you to respond to a concern. The only thing I would say is make sure, and you've touched on it, Adam, around making sure you've got, however that complaint comes in, but also for niggles, actually, how do you capture them? Actually, if it's lunchtime and somebody says, oh, my soup's not warm enough, actually, how do you respond to that? How do you feed that back to your staff in the kitchen? And what do you do going forward to prevent that? The only thing I would just like to bring people's attention to on this quality statement, if you go into the best practice, there is a link to the rapid literature review, which is the characteristics of a safety culture, which CQC commissioned a consultant to carry out the research, but actually it talks you through what the inspectors should be looking for in terms of a safety culture. So it's quite interesting read. So it breaks it down what CQC will be looking for. So behaviours of staff, how people communicate, how the organisation works, mentors and having a chance to discuss safely and informally, having ways to report. It literally goes on. It talks about staff tiredness, staff turnover. It breaks it down. It's quite a long read, but I feel like it's one of those things that actually you want to take time to read, especially if you feel like you might not have a completely open culture or something just isn't quite right. Because actually you could probably build a very good audit from this that you could then utilise within your teams. But yes, that's a good one. So the next quality statement is workforce equality, diversity and inclusion. So CQC say we value diversity in our workforce. We work towards an inclusive and fair culture by improving equality and equity for people who work for us. So I know earlier I said I don't feel like there's enough around equality and diversity. And I mean, even reading through this quality statement, I still don't feel like it goes far enough, if I'm completely honest. There's a lot of kind of talk around flexible working, which 100% advocate for. It does talk about the gender pay gap, which I don't feel like a lot of social care providers, I think I've only ever worked for a couple that have had a gender pay gap and commit to doing that every year. Talks about the well-being of the workforce, which I expect to be in there. But it links over to some of the other quality stuff. I still feel like this one could go further, and I wonder whether that's in the workforce plan from Skills for Care, because they've highlighted that actually it doesn't go quite far enough. Adam, what are your thoughts on this one?
So again, we've covered quite a bit of it already. But I suppose for me on this, it's around making sure that you are open and supportive to all types of people. Do you adapt for a person, or do you adapt your organization prior to a person joining you? And I think we spoke about this when we had Purple on the show a couple of years ago, around making sure that our services and our organizations are already accessible, even before we have anyone with any types of accessibility which differs from our own joins us. So, do you have cultural awareness within your team? Do you have disability awareness within your team? Do you have the ability to provide training in different formats? Do you have the ability to print off documents for dyslexia-friendly methods? Do you have yellow paper rather than white paper? Do you provide training on how to use technology in a more accessible way? Do you have an accessible website for your team to be able to use? It's thinking around all of these things that you could put in place, even if you've got no one who would require them at the moment. What you might find is people might benefit from them and they just don't feel comfortable talking about it. So making sure that our workforce is equal as it possibly can be. There's no other way of saying that. That comes as part of your culture. Mark, did we have this conversation last week, or was it the week before, where we were talking about giving everyone their birthdays off, and actually you might have people in your team who don't celebrate their birthday and then miss out on a perk? So how are you reviewing the perks that you give to your team? How are you reviewing if you've got an employee of the month scheme? How are you reviewing how well that's received? Are you doing a survey each year or biannually with your team where one question is, we have an employee of the month scheme. Do you think this works? Do you think it's fair how it's being managed? Do you feel like it helps your morale? What other things can we do to support you? Making sure that all of that's taken into account. Do you feel supported as an individual within this organization? Do you feel like all of your needs are being met? Do you feel like you are supported to be able to achieve the role the best that you possibly can do? I suppose when people are raising grievances or when people leave your exit interviews, no one likes the B word bully, but are we asking people, do you get on with the team? Are the team nice? Do you feel like you're being harassed by the team? Do you feel like any of the team bully you? Do you feel like any of the team are treating you differently because of who you are? You know, you've got people working in your team. Every single person on this show watching this tonight, which is Tuesday, not Monday, which is tonight, but tomorrow night, which is Tuesday when this goes out because we're not live. Remember that. But every single person watching this will have a diverse workforce. You might not think you do. You might think, well, we've got a white workforce and it's perfect and everything's wonderful. And we don't have diversity. We don't have to bother with any of this. Are all of your workforce just one gender? You know, you've got males and females working within your workforce. Are they all the same age? No, probably not. They're at different ages. And if you've got just a sort of vanilla white workforce, ask yourself culturally in your organization, are we inviting to people who look different to us? Because if you've only got a white workforce and you're in an ethnically diverse part of the country, you need to be asking yourself why other people aren't coming to your organization. And if they are coming to your organization, why you're not employing them. So it's all these little things that you need to think about. Your marketing materials, are they diverse in the way that they're put out? Do you have different genders and different roles? Do you have different nationalities at different levels of seniority? It's all really, really important to make sure that you're putting across this image that you are an inclusive workforce. It's hard to evidence. I'd say a lot of this will come from team minutes. It will come from supervisions. It'll come from your policies. So again, your EDI policy, your recruitment policy, your freedom to speak up policy, professional behavior at work policy, potentially. Have you got a sort of process around how to report bullying and harassment? Do you have it clear what the sort of HR position is within your organization? Can you evidence any steps that you've taken in the past? Obviously, you can't divulge personal information, but you can explain that we had this situation once and this was the outcome and this is what we changed from it. Not just we sacked someone, but what lessons did you learn from it and how did you implement those lessons? Do you have team members who you've taken on board, and I've spoken about it already, but with a type of disability, let's say dyslexia, and how you've adapted for them? You know, I know within my teams, I'm investing quite a lot in dictate to text functions so that people can actually dictate instead of typing, because it's so much easier and so much quicker and actually a lot better because you get a lot more quality in it. I get bored after I type after a while. If I sit there talking, a form might be 5 pages long, not 5 sentences long. So around all those little bits, to really showcase the work you're doing to make sure everyone's included within your service. Do you have champions? Do you have an EDI champion? Do you have a workplace champion? We've just done freedom to speak up. Go back slightly, but do you have a freedom to speak up champion within your organization? You know, do you have someone where people can go to just go, oh, I really need to get this off my chest? Do your team have the ability to get together on their own and converse and come to you with problems, or do you have to be in every single meeting? Because if you're in every single meeting, they might not feel, and I know I've gone back a little bit here, but they might not feel comfortable to bring these things up. If they do get that and you can improve your culture that way, you might improve your culture under this quality statement as well.
No, all great points. I've written down a few things just off the back of listening that kind of jogged my memory. I think champions, absolutely. I think if you've got champions, and I've seen this in a few of the support worker, the care worker groups and bits and pieces that I'm in, there's a number of them that have said they're a champion in whatever area, end of life, mental health, whatever, but they don't have the autonomy to do anything within that role. It's just a title. Actually, if you've got them, invest in them, upskill them, capture what they're doing, the changes they're making, what impact it's had to your team, to the people you support. Absolutely around accessibility of documentation and items, both for people you support and your staff teams. One thing from our PAMS inspection was that we had methods and we had organisations that would do that for us. Their argument was, well, if you took somebody on tomorrow, and obviously we're reablement, so it could happen very easily, how quick can that company turn it around truly to actually place an order and see? Because actually you'll have a number of organisations or suppliers that say, oh, we can do it within a week. And actually in reality, because you're only ordering one or whatever, either won't do it, which was a real good lesson learned for us. And actually PAMS were saying to us, you should actually just have some in the cupboard, not loads, you know, like 3, 4, and actually you've then got them should you need them. A number of organisations, not social care, talking about perks and what they want to do. And this is going to do a U-turn, I feel. So a number of organisations, and they've listened to their employees, but now don't really want perks. There's so much out there for wellbeing. They don't feel like they need that as a perk from work. They'd rather have it in their salary. a lot of loyalty, and I see this one in social care, a lot of loyalty that are very similar to the blue light cards, so discount schemes. Actually, I've already got a blue light card, then actually I don't need it. A lot of them where they're cashback, actually I can use Quidco or Top Cashback, so why do I need another one? So actually, like you said, Adam, speak to your staff. What perks would they like? The ones you've got, are they working? Are they not working? And actually, would you rather get rid of them all and have more hourly pay? Actually, a lot of people might prefer that. And just listening to you there talk around about your marketing and bits and pieces, just reflective of the local area you work in. Actually, if you're working in the middle of London and your marketing is all white males, actually, it probably needs to be a bit more reflective of where you're working. But yeah, no, all great tips there from you, Adam. Agree with all of it. So the next quality statement: governance, management, and sustainability, not to be confused with environmental sustainability, which we'll come on to. So CQC have said we have clear responsibilities, roles, systems, and accountability and good governance. We use these to manage and deliver good quality, sustainable care, treatment, and support. We act on the best information about risk, performance, and outcomes, and we share this securely with others when appropriate. So a lot of this comes around kind of your cybersecurity. We've done so many conversations around the DSPT, so the Data Security and Protection Toolkit. I think if you haven't got that in your organization, that's something that you definitely need to add to your to-do list. It's almost capturing some of the other elements, this one, isn't it, Adam? It's around kind of your strategy, your upskilling of staff, what you're going to do, what they've got in the pipeline, the roles, responsibilities, the accountability within each of your team. What are your thoughts here?
I mean, there's a lot here, and this is the biggie. That if you're going to sort of breach realistically on well led, get your warning notices. A lot of this is where your good governance is going to fail. So there's quite a bit here that you need to have ready to be able to evidence. And I'm going to reel them off slowly, and then I'm going to try and come back to them and go through them a bit. So, business continuity plan, governance tracker of some sort, dolls tracker to make sure. Again, I know this comes under other areas, but you need to evidence your dolls tracker, maintenance trackers. So any maintenance work that's going on or ongoing or planned. You want your training matrices, you want your supervision matrices, you want an employment and recruitment tracker as well to be able to evidence that. You want your accidents and incidents tracker, and you want to be able to have that tracker to triangulate with notifications that you've submitted as well. So CQC notifications, SUIs or SUIs as people call them, safeguardings, RIDORs, your duty of candor process. So there's your workforce dependency tool. Did I mention that? I don't know whether I did or not. Your workforce dependency tool, you're going to want that. You make sure you've got your statement of purpose handy. Regulation 12 under your provider regulations, your statement of purpose. So you want to be able to go through that. Make sure it's up to date. You don't just submit it once and that's that. It can change from time to time. So if you've had a new manager and you've not submitted a statement of purpose, you need to update it. So look for your statement of purpose there as well. So there's a lot here, and there's probably a ton more that I've missed off. I'm just reeling stuff off in my head that I've got written down reading this. So your business continuity plan, is it up to date? Does it cover everything you need it to? Do you have a place of refuge to go if you need to evacuate your home? Have you got a partnership with another nursing home or a care home? Or if you are a care home or nursing home, that is, you might be a home care. This probably doesn't apply, but have you got that agreement in place? When was that last checked? Is it still valid? Are the contact details still correct there? What are you going to do in the event of gas, electric, your other utilities running out? What are those processes? Have you got that understood? Are they in there? Are they accurate? Are they up to date? You're going to want to put things in your business continuity plan around data protection, data breaches and governance, shortages of your team members, a disruption to service. How are you going to approach that? What are you going to do within the first sort of 12, 24, 48 hours? If you're a community, and a road closes and that's a main road to get to and from your service users, how are you going to change that? What are your contingencies in that place? So your business continuity plan needs to be really, really big, really, really robust, and needs to be updated regularly. I would say review your business continuity plan at least quarterly to make sure that you're accounting for any sort of changes. It just takes a member of your team to change and your business continuity plan is out of date. So I would say review them quarterly to make sure that it's got everything in that you need to be in there, because that is going to help evidence your ability to react in a crisis. Let's say the water runs out. Have you got in your business continuity plan what sort of stock of water you need in your building to make sure that you can continue providing safe care? Have you got distilled water in place in case you need to use distilled water for medical treatments? All of that sort of stuff you want to be included. We're coming up to winter, right? This is the sort of time of year I'd say to everyone, just double check your business continuity plans just in case, because it's going to start getting cold. So let's start making sure that we're sort of prepared for that moving forwards. Statement of purpose is what it is. Make sure that that's up to date and you've got it. Your workforce dependency tool. Make sure you can evidence your workforce levels and you understand why you've got those workforce levels. You understand in your workforce dependency tool, for example, you've got things like fire evacuation included onto it. There's nothing worse than doing a dependency tool going, well, this person needs this level care and blah, 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 and you've done it. And then heaven forbid an emergency happens and you realize that actually every single person in your home requires 2 people and a hoist to evacuate. They may not have that many care needs, but actually in an evacuation they are really highly dependent. That will affect your workforce numbers for your days and your nights. So making sure you've got a robust workforce dependency tool. I would say employer governance tracker of some sorts. So tracking your risks throughout your home, tracking your workforce numbers, tracking your occupancy, tracking infections, tracking incidents, tracking falls, tracking pressure ulcers, and tracking accidents, tracking pretty much everything, so that actually each month you can review it and go, we've got a risk starting here because 50% of our people have had a UTI this last month. That is huge. That is a risk. What do we do about this? Let's do an investigation. Let's deep dive into that to sort of preempt anything happening moving forwards. If you don't do anything like that, you're just going to have UTIs in your home. What they want to see is good evidence that actually you're responding to immediate things that are happening within your service. You're identifying them and you're employing techniques to try and either mitigate them, reduce them, or if you can't do any of that, maintain and manage them in a safely manner. Maintenance trackers, I think, are a must. There's nothing worse than not keeping track of what needs fixing and what needs work. So again, if you're a nursing home, a care home, or a single site service, not domiciliary, for example, making sure that maintenance tracker is up to date, that it's managed, and if things are on there, you've got actions that are on there. I will say, if you've got external services doing risk assessments for you, so fire risk assessments, electrical safety assessments, Legionella assessments, structural assessments, health and safety assessments, they will come with action plans. Act on them, show that you're acting on them, put regular updates on those risk assessments and those action plans. They're going to want to see those being managed and have them to hand. You don't want to be going fishing for stuff during an inspection. You want to be able to find everything centrally or locally. You either do that in actual folders, make sure all your folders are nice and neat in a cabinet in one place in the safe. In this day and age, it's always good to back up as well. So maybe you have them stored digitally. Do you have a OneDrive where everything's stored? I use Radar, for example, in my organization, and we're building up a centralized document section on Radar, which we can all access. But actually, how are you backing that up as well? Training matrix is self-explanatory. I would have 2 ready to be able to show them. So if you are digital and you've got your training matrix, I would have one that shows new team members, one that shows all team members, because if you show a training matrix and you've just had a recruitment drive and taken on 15 team members, your training levels are going to be really, really low. You want to be able to evidence that actually 15 of those people are new starters as well. So you want to be able to see both figures and both numbers there. And you're going to want to make sure that they've had training around things like data protection, confidentiality, GDPR, record keeping, amongst everything else. But for this, really important that you've got evidence of that as well. An employment tracker. So how are you tracking employment? How are you tracking safe recruitment? Are you dating when your DBSs have been sent and how often you've chased them up? How often you've chased your references up? For those that employ clinical nurses, do you have a PIN tracker? So do you check annually someone's PIN to make sure that it's still active, that there's no restrictions on their working practices? If you do, really good practice just to check the PIN before they start, and then you can load that up already and it's good to go. If you've got people on a DBS update service, do you have a DBS tracker as well, where you're constantly checking people's DBSs throughout the year just to make sure that there's been no restrictions put on them from that way as well? There was a couple of more things, Mark, that I wanted to bring up on this one, but I've forgotten at this moment in time. So if you start talking, I may remember.
No, that is fine. I was listening to you, and I think it's all great stuff. And I think there's going to be probably some managers or directors, people listening that think, bloody hell, that's a long list, and I don't really know where to start. That's fine. Rewatch this on catch up and create an action plan. It's okay not to have everything in place. Actually, put that action plan together and list all those things that you need to implement. And if the CQC knock on your door tomorrow, actually, you can say, we've highlighted we don't have a training matrix, but actually we're doing something about it, and here's what we're doing. We've already identified what we have and haven't got. The only thing I would say is this section, do head over to our website, because actually we have so many of these tools already. So there's a free resources section on our website. If you click on quality assurance, if you haven't done the DSPT, there are audits that walk you through this around the policies and procedures, the IT systems and devices, takes you through it. If you click on the business template section, there is an action plan template. So if you do need that, but it's got a continuity plan template on there. It's got a flood guide. It's got a service improvement plan. It's got a winter plan. It's got a workforce development plan. If you go into the free resources, into audits, there's an audit schedule. There's a daily walk around schedule. There's a fire safety schedule. There's a falls and nutrition audit. There's a Regulation 17 responsible individual observation visit record. So there's lots of records that Adam's spoken about that actually you can just hop onto the website and download for free. The only thing I would say with your training matrix is CQC will go by what your policy states. So if you say you're going to have 80% of your staff trained, make sure your matrix reflects what your policy says. So just do be careful if you've used a generic company that writes your policies, what is listed in there and actually what is in practice. Adam, if you remember what you were going to say.
No, I have remembered, but also just on that, and I'm going to say, and I'm probably going to forget what I've just remembered, but just on what you were saying then, it'd be, I want to be that person that goes, all of our team are going to be trained. We're going to have 95% training across the board. You set that standard, and if you do not hit 95%, you've set yourself to fail. You know, I would say a comfortable 85. A comfortable 85 means that you've got a couple of percent below the 85% before you start getting into warning territory of I'm going below that training threshold of 80%. But again, your training matrix is a training matrix, and that's all it is a matrix. So how often are you reviewing that matrix? Do you do an audit of your training requirements? And are you noticing areas of your training that are starting to slip below, I don't know, say that 85%? And if so, have you got action plans on boosting that training level up again as well? So although you might be able to say to CQC, look, here's our training matrix, and that's great. If you've got training below 80%, they're going to be saying to you, well, what's your plan on getting that training above 80%? You're going to be able to want to evidence that you've looked at it, you've reviewed it, you've put action plans in place, you're auditing it, and you're working on that. You've identified that future risk, you've identified that future concern. Have a folder for your CQC notifications. I know this is old school because we should just be able to go onto the portal, but the portal's crap. It doesn't work. We all know that. In fact, I think they stopped us reading notifications on there because of GDPR concerns of something that had happened. Make sure you've got your CQC notifications folder to hand, but make sure that you have got a matrix of your incidents and accidents. And I'm saying matrix because I don't know how you manage your services. You may have a digital system like myself that will put your accidents and incidents, and then you can put your SUIs, your notifications, and all of that all under one roof, under a workflow. Perfect. If you don't, and you're managing your incidents and your accidents on your digital social care record system, but that doesn't have an option for your lessons learned, and it doesn't have an option for storing your notifications, how are you making sure that all of that work's done? So an internal process of going, we've had an accident and an incident, and this is our process moving forwards. That's great. That's going to come under your safe. That's going to come under your effective. That's going to come under your responsive. But good governance, how is that all being stored? How are you triangulating that, and how are you ensuring it's being done? So having a good matrix for that as well is going to help you. Risk assessments, make sure you've got your risk assessments in place, make sure that they're reviewed annually, make sure that the person who's conducted them is competent and to be able to do that. And I would also say focus on your NICE guidance. Make sure you've got NICE guidance embedded throughout your service, and any evidence of your receipt of MRHA drug alerts. We get them through quite a lot. But also a safety. So MRH drug alerts, they're the things that I like. The most infamous one is about the paraffins. You know, be careful because of fires. And if you've got people on paraffin oils, what are your risk assessments for that? And I'm thinking for your environmental risk assessments here, if people are using paraffin creams and paraffin ointments, how are we washing their blankets? How are we washing their clothing? If we're washing their blankets, are we storing those blankets with blankets for people that aren't using paraffin creams? Are they stored near heat sources? Are we washing them twice to make sure that that paraffin oil's off them? All of that's really, really important to consider. You might not need to do anything with it, but you can showcase that you've evidenced it within a risk assessment. I would also evidence any sort of communications that you get from your local authority and your ICBs. We received one through today in Leicester, and sadly, a resident has fallen out of the window of a home and has died. And part of that investigation so far has found that I'm sure I'm allowed to talk about this. It came out via email. No names. I don't know what the home is, but I'm telling you anyway because maybe you'll learn. Not you, Mark. People listening to this. Not saying that you need to learn. I'm being really rude. But part of the reason why this resident fell out the window is although there was a window restrictor in place, the window could still open wider than 10 centimeters, so 100 millimeters. So making sure you've got things like your window restrictor checks that you're doing on a monthly basis, making sure you're doing your checks on your equipment, making sure you're doing checks on radiators and for scalding, making sure you've got risk assessments for scalding. There's a lot under this good governance that also translates over into the safety aspect, but they're going to want to be able to see you evidencing. Again, your data management. Have you got a policy in place for a data breach? Please tell me you're registered with the ICO. You need to be registered with the ICO. If you're not registered with the ICO, and the only thing you do after listening to this is to go and register with the ICO, go and register with the ICO, Information Commissioner's Office, total must. You need to be able to do that. But think around how you're managing data breaches and data risks within your organization. Do you employ a clear desk policy? So you make sure that everyone's desks are tidy and clear from any personal information before the end of day. All those sort of things. And do your team understand how to report those data concerns? And have you got the processes in place to be able to do that effectively? Think about the other quality frameworks that are out there. Think around training that is out there. Think about yourself as a leader. Have you got everything that you need? Really utilize the best practice guidance on the CQC website because there is a lot of it on there. Not all of it will be applicable to yourselves, but a lot of it is super helpful and super handy. And document where you've learned stuff from as well. Have a continual learning record running of, I went to this event, I learned this, we implemented this, the impact was this. All of that's going to really, really help you, but none of it will matter unless you've got oversight. None of it will matter unless you know everything that's going on in your home. You might not be responsible for that job, but as a registered manager, you're responsible to know what's going on. Fire risk assessments come through. They need 1,000 things fixing. You're not going to fix them. What you need to know as a registered manager is that it's been done. So how are you checking on that on a monthly basis? How are you keeping up to date with everything that's going on in your home? How have you got that oversight? How are you understanding it? This is super important, this quality statement. There's a lot here. It's a meaty one. It's the one that's going to give you the most anxiety. But I think with the correct tools in place, you'll nail this off. Super great. CQC will walk through your door and you can go, yep, I do all of this, I do all of that. This risk assessment, yeah, we picked this up, but we actioned this and we did that. So actually, we're going to redo this risk assessment and it's going to come out lower because we put these mitigating actions in place and we've monitored them and this is the impact we've observed. All of this is super important. I feel like we could do a show just on this quality statement and cover all of the aspects of governance. But yeah, super important.
The only other thing that it also does on the CQC website is, I know we discussed this on the last show we did, there's not many quality statements that link to the local authority assessment. This one does, so it falls under theme 4 of the local authority assessment, which is leadership. So definitely go through and check that because it talks about strategic planning, learning, improvement, innovation, governance, and what they're checking there. The next one is partnership and communities. So we understand our duty to collaborate and work in partnership, so our services work seamlessly for people. We share information and learning with partners and collaborate for improvement. And again, this one does link to a local authority assessment. So this one links to theme 2, which is around providing support. So around commissioning, integration, partnership working. The only other thing before I come to you, Adam, is I'd also just check out the best practice. It doesn't look very obvious. The only best practice guidance on this one is Effective Systems of Health and Care, CQC. But actually, a bit like what I said earlier, consultant company that they have paid to come in, and it breaks it down what they're looking for here. So working with voluntary and community services, working with local people. You've got a clear strategy, committed leaders, engaged leaders. You've got performance indicators for improvement, a strategy and vision. Financial well-being is in there for your company, not for your staff. How you partner with organisations, how you meet the needs of the local. This one, I think, doesn't look very meaty, but I think once you start dipping your toe in, actually there's a lot. And I think if you utilise that kind of research that they've had done, it will break it down into a real step-by-step for you. Adam, thoughts on this one?
I'll keep this one brief because I think you covered quite a bit there. I would say here, evidencing wise, are you part of your local registered manager network? Are you part of your local quality improvement network? Do you attend provider forums by your local authority or your ICB? Are you part of your care association in the local area? Do you attend quality cafes? Do you attend care cafes? Are there anything like that in your local area around that you don't currently attend? Because if you get an email every single month from your local authority saying, we have a workforce group, why don't you join us? And you go, nah, can't be bothered. I think you should. And I think you should join. Cost, I know, is a lot. So your local care association might be out of the question. However, think around all of these forums that you're missing out on where a lot of good practice is being shared. You could have been going through something yourself and think, do you know what, I wish I could tell all these other providers about it because they can learn from it as well. Yeah, we've got the Facebook groups and we can learn from them, but actually on a collaboration part in our local areas and our local places, are we part of those events and can we communicate them, our lessons and what we've learned? Are you sharing when you've had an incident or a safeguarding, for example, or a major incident, are you opting to share that with your local authority as well? So let's say you've had a data breach and you've handled it amazingly and you've identified how that data breach has come across and you might be able to support other providers in mitigating that risk moving forwards. Have you got in touch with your local authority or your quality team and gone, oh, by the way, this has happened. We'd love to be able to share with you what we've learned. We'd love to be able to share with you our findings and our learnings from this. I would say make sure that you're evidencing your work with people like your SALT assessment teams, district nurses, tissue viability nurses, trachea nurses, PEG nurses, hospice nurses, making sure you're demonstrating you're open and you're working with local training. Does your ICB provide training? We're very lucky in Lancashire and Leicester, actually. We've got quite good training put on by our local authorities and ICB. Are you evidencing you're working with them there? Can you evidence working with care home teams, with GP teams, with transport teams? Can you share learning with them through that? Are you engaging in surveys with your local authority? Are you sending out stakeholder surveys? So you're actually sending out surveys to the people who come and work with you, going, how do you find working with us? You know, how do you find our team? How do you find our openness? How do you find our approachability? What can we learn from your experience in working with us? So a lot of this is easily evidenced, and some of it gives you an afternoon out of the office with a coffee and a cheap cake and time to meet other providers as well. It's really important that you start engaging with your local networks and working with them. I've got one tomorrow afternoon with the Lancashire South Cumbria ICB and local authority around the workforce group. We're helping shape the workforce for the area. It's great. You know, we get to give them our real life experience of what it's like to be a social care provider. It changes the way things are. Evidence it. It shows you're working and you're being open and you're being transparent and you're being collaborative with these other people. I would also say, if you've got things that you're struggling with, I've got a huge belief that there are no stupid questions. The only stupid thing is not to ask a question. When you go to these events, make sure you're asking those questions that you think are stupid. So, oh, we have this and we don't know how to deal with it. What we're going to do? Oh, well, actually, we had this as well, and this is what we did. Brilliant, great. Oh, I'm really struggling to manage this. Has anyone got any ideas about how I could manage it differently? Yeah, you could try it like this. It worked for us. Great. Great place to learn other people's innovation. Great place to share your own innovation as well.
No, absolutely. And I think just from my own experience of attending those events, I think sometimes as well, it gives you a chance to think about what you want to do. So you've not only got that best practice sharing, you've got people that are talking and that gives you ideas. I think sometimes when you're sat there listening, you think, oh crap, actually I haven't done this and I need to do that. And actually you end up with a massive to-do list by the end of it, but it's all proactive stuff that you can do for your service. I think listening to you there, Adam, if there's anybody listening that thinks, well, I'm trying to get on my ICB board and I'm trying to get on the IC, if you can't, document how you're trying, because actually then when the CQC say, well, why are you not on it? You can say, well, it's not through lack of trying. And this is my evidence of how I'm trying to get onto it.
Yeah, 100%. 100%. I would also say, and I know we do the capacity trackers, mandated capacity trackers. It's not really worth the input that we're putting in. Evidence that you're getting in touch with your local care nav teams or whatever they call themselves now, care liaison officers, wherever they are in your area. Just letting you know, we've got 3 beds available in our home this week. They are for this type of care need, or we've got 400 hours which could provide you on reablement or on home care or on this. Make sure that they're aware of the services that you can offer. Make sure they're aware of the support that you can provide them as well, because again, coming up to winter, keeping in touch, keeping those local connections open, keeping that avenue of dialogue open is going to help them support the transition of other people into other services as well. So make sure that you're keeping them abreast of all of your abilities and what you can and can't do, especially if you can't do something. You don't want people going, well, I'm going to send them to you. And you go, actually, no, we really don't have the capacity at this moment in time. Let's say you've noticed an increase in people needing specialist care, so maybe enteral feeding, and you go, well, actually, we're not really equipped for this at the minute. Is there a local Abbott nurse team? Is there a local team around me that can come and provide us that enteral feeding training to help us then take on these clients that are struggling to find placement at this moment in time? Because what you can then evidence is you've listened to the referrals coming through, you've adapted your service to meet those referrals, you can now meet the needs of those people on those referrals, which is reducing the burden on your local commissioners. All of that is really great evidence for working in partnership with your local communities.
No, absolutely. So we have gone over the hour mark. We've got 2 more quality statements. No, don't have to apologise. It's all great stuff. And I'm writing down as much of a list as anybody else. So the next one is learning, improvement and innovation. And that's what this is all about, what we're doing tonight. So CQC say we focus on continuous learning, innovation and improvement across our organisation and the local system. We encourage creative ways of delivering equality of experience, outcome, and quality of life for people. We actively contribute to safe, effective practice and research. Now, I know I said there's not many of the quality statements that link to the local authority assessment, and now I feel like I told a white lie, because this one does as well. This one links to theme 4, which is around leadership. So what a couple of the quality statements link to. So again, that learning, the improvement, that innovation, and the management and governance. So do check that out. Adam, what are your thoughts on this one?
So again, I probably won't spend much time on this one. I know I said that on the last one, but I probably won't spend much time on this one because it is very similar. So around how are you engaging in your local teams? How are you engaging in local work that's going on? Is there any research projects going on at the moment that you keep getting emails for that you've not got involved with? So it's around having a look at what's available, having a look at what's in your local area that can support the development of your own service, but also other services as well. I would be expecting here understanding around change management. Have you got policies around change management or training around change management? Have you got a policy around continual quality improvement? Top tip, they also want to see a policy around learning outcomes as well. If you don't have one, we can put a draft one together and send it out for you. So around making sure that you've got those quality improvement plans, those quality improvement processes in place and people understand them is super, super important. Making sure that your learning culture is there. So again, this would come under your policy of learning about when things go wrong, your learning outcomes, your lessons learned, and that you can evidence how you're improving and learning from them. But are you also asking your team for self-reflective statements? So, I noticed that you administered that med then, but you did it and touched the tablet and you weren't wearing gloves. You didn't follow the no-touch technique. Can you tell me why that is? And in fact, do you reckon you want to do a bit of a reflective statement for me on what led up to that for me? Or, that's a really crap example, but anything like that, asking our team to do those reflective statements so they can reflect on themselves and then hopefully come up with some solutions prior to having, say, a supervision with you around how we're going to manage this moving forwards, how we're going to improve moving forwards. Mark spoke earlier around making sure that the directors and manage challenge each other, and you need your team to challenge you as well. It's a really, really important aspect. If you don't have conflict in your organization, people aren't going to commit, people aren't going to engage, people aren't going to believe what you're doing. You want to encourage that conflict, good conflict. Why are we doing it like this? Could we try it like this? Or I've got this idea and it might work better because of X, Y, and Z. Promoting them to come up with those problems. Circle of control is a really great exercise to use if you don't do it. Circle in the middle, circling around that circle, and a circle around that circle. So it's like a target. Anything outside that outside circle, you can't do anything with, you can't control. Anything in the middle circle is what you can influence. Anything in that center circle is what you can directly control, and using that with your team to help problem solve is a really cool technique. And again, embeds that idea of accountability and responsibility when it comes down to problem solving, and put some of that onus back onto them as well. One of my favorite things to do is if someone comes to me with a question to a problem and they'll go, "Oh, we've got this problem, what should we do?" My first response 9 times out of 10 is usually, unless it's like, "Oh my God, there's a massive emergency," my first response 9 times out of 10 is, "What do you think we should do?" Put that onus back onto them and make sure that that gets embedded within your culture as well. Make sure that that idea of continual learning is in with your continual learning improvement quality policy. And then, just showcase how you've implemented new things into your service. Don't just say, "Well, we've done this because some research said we should." Demonstrate your own impact of it. Well, we saw that this might happen. Prime example, I went non-uniform years and years ago. This is what we want to do. This is how it's affected the service. This is how it's affected the team. This is how it's affected the residents. We've not just done it to get likes on Facebook. We've done it because actually we want to improve the life of people using our services. So show how that's been embedded within your service and show the outcomes of it as well. And then show how you've shared that out with other organizations, with other providers, to be able to evidence it. It all is just around that ability to continually learn, to continually improve. Do you have an internal QAIP that's ongoing? With your audits, when you've done an audit and it's come back and it's failed in areas, great, fine. But how have you learned from that? What lessons learned have you done? What have you taken from that audit? Have you put together a risk register? Do you know what a risk register is? If not, learn about risk registers. But have you put together a risk register? We've done 3 MAR audits this month, and on every single MAR audit, we've come up with people missing signatures. Huge risk, huge risk. Let's put it on a risk register. Let's put some controls in place and let's manage that risk, because we've learned from our audits. We've put it together into a risk register. We've come up with a plan of action to mitigate those risks. It could be retraining. It could be competency assessments. It could be more regular auditing. It could be observations of medication rounds. It could be anything. And then we're going to monitor that. And then we're going to re-audit and let's see if anything's improved. Because you want to learn from your audit, put actions in place, re-audit, and hopefully your service is improved along the way. QAIP, that's your quality and assurance improvement process, just continually improving. And you want to be able to evidence that in this area as well.
Perfect. Thank you very much. Just quickly before we dive into the last quality statement, the only other thing I would recommend is when it talks about improvements is if you go on the CQC website and go under their publications, they've got so many driving improvement case studies. So a really good one is one called Driving Improvement Through Technology. I'm sure if you Google that and CQC, it will come up, but it really breaks down some case studies that they've looked at around digital records, laptops that clients have used within a home, mental health services, telemedicine, telehealth, telemonitoring. There's improvement case studies from mental health trusts, from local authorities, from GP surgeries, from hospitals, improvements where it's made a difference to individuals. They're full of links, but I think they're a really great resource when you've done all the other things that you want to do, to then just be able to go on and see actually, is there anything that we could do that would make, vast improvement to either the team or to the people you support. So definitely do put that on your kind of to-do list, but I would say at the lower end of your to-do list. So last but not least, environmental sustainability and sustainable development. So CQC say, we understand any negative impact of our activities on the environment, and we strive to make a positive contribution in reducing it and support people to do the same. I don't think this was any surprise this was going to be on here. Obviously, this is going to be inspected on very soon. They gave us leeway for the first part of the framework when it rolled out, but it's here. Adam, what are your thoughts on this one?
Can I just go back to the previous quality statement just very quickly? I know this is going to confuse people watching. Make sure on that governance tracker that I was talking about that you're monitoring hospital admissions. Any hospital admission that was unavoidable, what have you learned from it? How are you going to improve from that? How can you identify those avoidable admissions again in the future? But also around deaths. So have you got any deaths at the moment that have happened that need learning? Were they good deaths? If someone dies, first question, was it a good death? If not, what can we learn from this to make sure that other people die better? And then also assessing to see if there's any concerns that you might need to have a look at around coroners. Now, that's not something I would say divulge to the CQC, but for yourselves, just check to make sure there's nothing around that person's death that you might think, oh my gosh, this is going to end up at coroners. So making sure that all of those concerns are logged as well. Sustainability. No surprise it's on the list. No surprise they're not inspecting alongside it at this moment in time. Personally, I feel, Mark, that there needs to be more done in support of social care providers to start becoming more sustainable, because at the minute, there really isn't much out there. And the options aren't great. And if we want to think around being sustainable, I think a lot of providers at the moment are just trying to be sustainable and viable rather than environmentally friendly, although we should all be. And there are the costs involved to be able to benefit that. I think for myself, I would recommend starting off small. So providing those educational programs to your team, making sure that recycling is followed within your services, make sure you've got your waste contracts to hand, and that you've asked for their sustainability pledge, for example. Document that, record that within your own systems. Potentially document when you're taking on a new software or taking on a new system or employing a new company to work with, that you're asking for evidence of their sustainability pledge. Because then, although you're relying on them, you're asking them to demonstrate their commitment, and you're doing your due diligence by asking as well. So I would say, have a look at that. I think a lot of sustainability, especially if we think recycling, and we did an episode on it not long ago, Mark, starts at home. So training your team at home first. So making sure that we're putting together. I think, Mark, we talked about it when we had Hannah Montgomery on. And I said, run a competition with your team around who can bring the heaviest plastic brick in. And a plastic brick where you get an old bottle and you shred your non-recyclable plastics into it. So like your crisp packets, your cat food wallets, all that sort of stuff. And you ram it in a bottle and see you could bring in the heaviest plastic brick. That's a really sort of great tool. They get a prize, potentially a voucher for the heaviest one for that month. And then you can order a group collection of those plastic bricks to go to a site where they can be used effectively. It's less plastic going into landfill, makes it a bit of fun, but it's also something that your team can get involved with. Do you have things like vape disposals? Do you have things like battery disposals and dispensers at work? Are you looking at your stuff that you purchase? Are you using sustainable products? Again, I know a lot of that is cost. But it is really, really important that we start thinking about that. Do you offer a bike to work scheme? Do you offer the ability for people to car share? Do you encourage car sharing? Loads of different things. Are you on a public transport route? And if so, is there a way that one of your benefits could be discounted public transport passes? Again, I know it comes under tax and all of that sort of stuff, benefit in kind for employees, but it's something to consider. It's something to look into. Is it that actually for people who travel by bus are on an elevated pay? People who don't travel by car aren't on an elevated pay. I don't know how you evidence that. There's loads of different things that we could start looking and considering. It's just all new to us. This is an alien territory where easy ones, weigh your food waste. Are you weighing your food waste? Are you monitoring your food waste in that way? Really great step. Reduce your food waste, reduce your costs, reduce the effect and the impact on the environment. So there's loads of little bits that we could do. And we could start off doing. I think I spoke about recycling old offcuts of paper, Mark, and turn them into crafts or turning them into new paper, as long as they've not got delicate information on. So there's things that you can do. I think you are going to have to put together a reduction plan for your CO2, for your footprint. How that looks, I don't know. I'm still to do one myself. I'm still to look into this myself, but it's something that we need to start doing. we have had a bit of a leeway. I'm hoping the leeway is extended, seeing as the rollout of the single assessment framework has been a little bit rough. So I am hoping that the rollout of the sustainability side will be prolonged, but we will be doing some more work on this at the Caring View. We will try and put together examples, templates, toolkits for you that you'll be able to use, because at the end of the day, we'll be able to use them as well. It's just a bit of an alien one, this, because they're not currently inspecting at the moment. We've got no evidence to go off. The only evidence we'll have is from our health partners, and that doesn't really translate over into social care. So it's going to be interesting to see how this goes, Mark.
Yes. So I'm going to try and get this out in order. I've been scribbling it down in the background. I've got everybody covered here. So I was messaging, I was like, can I release this? So some things. First of all, you mentioned it, Adam, the sustainability show that we did with Hannah Montgomery from Grace Cares. If you didn't watch that on our YouTube channel on Catch Up, because there were so many great tips that you could take away just from that conversation. If you don't know who Hannah Montgomery is or who Grace Cares are, do go and check them out. So they are grace-cares.com. They also have a Caring for Tomorrow webinar series, which is a quarterly meetup for health and social care providers. It's free to attend. They talk about success stories, funding parts, ideas to meet the requirements from the CQC, and you can book on and join for free. I am very conscious that I talk about sustainability, but I own an ice cream van, which I always feel is a bit hypocritical because it's not the most sustainable thing with the fumes and the engine being on all the time. So the things that I did was I moved straight away to a digital system. And I think some of these things that I've done, we will already have done in social care. So actually, I think we look at it, but we don't think about what we already do. So some of the things I did was went to a digital system. So the ice cream van I bought, everything was paper-based. Actually, you reduce that paper by going electronically. And a lot of the things that you can move electronically, you don't need to pay for. Energy-efficient light bulbs, which will reduce carbon emissions, also save on your energy bills. Reusable water bottles, as opposed to, plastic water bottles. Eco-friendly cleaning products. Look at the suppliers and who prioritize sustainability. Adam's already spoken about recycling programs, what you can and what you can't recycle, carbon footprint, so you can check that out. I will do some posts around sustainability in the lead up to the care show. So Adam and I are talking at the care show on day 2 on evidence in sustainability in home care, on the Home Care Theatre on the second day, so the 10th of October at 12:15. And we are joined by Hannah Montgomery. So we will have some bits and pieces for you. If you are at the care show on day 1, on the sustainability zone, at 12:15, we are actually, so the Caring View have worked with Grace Cares and have been sponsored by Attis Care Insurance to put together a sustainability guide for care managers. So there are going to be 2 versions. Sorry, I'm clicking around all my screens here. So there will be a free version, a taster guide into sustainability, which you'll be able to get and download at the sustainability zone at 12:15. But there also will be a book version, so either an ebook and a paper back book that you can buy and purchase, which is going to take you through everything you need to know to meet this quality statement and so much more. And I think if you don't know where to start with sustainability, this guide will really help you break it down. It's something you can use with your teams. There's action plans in it. Something that we've been working closely with them on for, I think, ever since we did that show and the event with Hannah when she joined us. So keep an eye out on that. But I'll share some of the infographics that have been created around that as well, because I know that the first time round when I shared them, which must have been probably about 3 months ago, they were really well received, but I'll pop them back out on the socials as well. Adam, anything else on this one?
No, I think you nailed it there, Mark.
I'm surprised I got all those links out. I was like dotting all over the tabs, but I'm really looking forward to this, because I think there is still, like you said earlier, there's not much knowledge on the CQC. There's not many links other than the NHS, and I think this will be a great resource for care providers and managers that want to do more.
Yeah, definitely. I think it's going to be fantastic.
Well, that is the end of this domain, the end of the quality statements. I feel like we ended it on a high, a very meaty one, though, the last three.
They are. I love the well-led domain. I think it's. I like my leadership style, don't I? I like the learning, the quality improvement. That's why I'm in quality. At the end of the day, it's something that I love, and I think it's important that we get our heads around it. But it's just important to remember that this is where a lot of process evidence is going to be coming from as well. Your oversight is going to be hugely important here as a registered manager. So making sure that you've got everything to hand that you're possibly going to need. If you don't know where your statement of purpose is, try and find it. If not, rewrite one, resubmit it. It is part of the regulations. You do need to submit your statement of purpose every single time you change it as well. You need to let them know what those changes are. So make sure that you've done that. And yeah, your business continuity. There's a lot here. There's a lot to do. We will try and get some more free resources out. I know I've built a few things recently, which I should be able to adapt and share out as well to support other people. And I can send out a draft of the governance tracker to help calculate on what's going on. So there's a lot we can potentially do to support you. I would just say if you've gone through the inspection recently and you want to share what that inspection was like, please do let us know. Please do get in touch. We do want to do a show on that. But it's been a journey doing these quality statements. No doubt we'll be reviewing them when the Penny Dash report comes out as well, and the whole process of the CQC inspection, depending on what actions CQC take.
Oh, well, I was going to say the whole thing could change, but I don't think it will. So do not fret.
We say.
Well, we do. The only thing I would say is we've spoken about the care show. On day one, we are on the keynote at 10:30 talking about regulatory reflections and how we can ensure care quality with all the changes that are happening at the moment within the CQC's leadership team, with the Penny Dash report, with everything else kind of going on in the world. So yeah, be sure to join us for that. We're going to be joined by HCR Law and Julie Garrity for that one.
Not to be missed.
No, that is not. If you haven't got tickets for the care show, you can get them for free. So the link should be on your screen right now.
Looking forward to it. So this is a reminder, the show was not live. We've not ignored your comments, but hopefully you put comments through. You can catch up with this as often as you would like on YouTube or on our website. Please do go and find it. If you follow us on LinkedIn, I think you can go and rewatch them on LinkedIn, Mark.
Yeah, you can indeed. LinkedIn, YouTube, you can watch on catch up. I believe even on Facebook now. So.
Oh, very good. We will be back next week. Usual time, usual day, Tuesday at 7:30. Again, only possible to do this thanks to our sponsors. So quick last minute shout out to our sponsors. So we have Prosperwell. Again, their addresses are running across the bottom of the screen now. We have Care Business Associate Training. We have Attis Care by Attis Insurance Brokers, Log My Care, and with the wonderful Florence. But until then, get preparing for your CQC inspections, get learning your domains, get learning your regulations, get yourselves prepared. Let us know how things get on. Ask us for advice. We have a WhatsApp group, don't we, Mark, where people can ask for advice?
We do indeed. I need to do a social media push on it because I've had a couple of people last week mention about it and how to join. So, yeah, watch this space. It won't be tomorrow. I need to, well, actually, it will be tomorrow by the time you watch this. So I'll do it tomorrow. It'll be Wednesday morning. I'll put it out on the socials.
Join that, ask your questions there. We will support other providers in there that will support you. Mark and I don't have all the answers. We've never professed to. We're just giving a platform for people to get those answers out. But until then, it's been absolutely fabulous, Mark, spending this Monday evening with you, going through the CQC well-led statement. And to everyone else, we will see you soon. And if we don't see you on the show, we will see you at the care show. So take care.
Good evening.